Good morning, everyone. This is Dr. Shanthala, and so we just finished treatment, one of the CoolSculpting procedure here, and what you see here, it is the Z wave or shock wave or radio wave. This is a high energy sound wave which is delivered after the massage, after the CoolSculpting. There is a hand massage, and then this is applied. So with this one, you can reduce even more fat, and the discomfort after the CoolSculpting is a lot less. So as you see here, this is my beautiful esthetician, and that is the you see the machine on that side, which she's using, and this is a beautiful model. And as you see, she's really gorgeous, and then she's got the perfect body. But her concern is no matter how much she exercises, she has that little bit of fat in the lower abdomen below the belly button. So that's why she's only doing 2 small applicator. So when it comes to treatment for the abdomen, really depends upon your goal, or it all depends upon when you wear your clothes. If there is an extra bulge, that's what you want to treat. It's not a weight loss procedure. It's not like it's called stubborn fat. And the idea of doing CoolSculpting is to really, no matter what you exercise or what you eat, sometimes it's so hard to get rid of certain fat in certain areas. So that's called stubborn fat, and that's what we are doing here today. And she's young, gorgeous, and she has this little bit of belly fat which is bothering her, and that's why she got it. So now we are going to be applying the second applicator. As you see here, she is using that wipe. That wipe is not alcohol. She's not trying to wipe off the marking. So that is really, it's a medicated gauze where the cold is going to penetrate deeper inside the skin. And as you notice here, this is the side we just finished, and it just looks a little bit pinkish, and that pink color of the skin will go away by the time the other one is done. So as you see, Arlene is wiping that part of the skin, and she will be applying the applicator. So I'm sure most of you know CoolSculpting is a procedure where the cold is delivered into the skin in a controlled fashion. It's below freezing, and it does not really damage, it does not cause cold burn. But when this cold is delivered deep into the tissue, it really affects the fat cells. Those fat cells are going to be what is called as apoptosis, or they commit suicide. The fat cells die. So and it does not cause any necrosis, it does not cause any fibrosis, it does not cause any nerve damage, it does not cause any scarring, it does not cause any infection or anything. So that's why this is very popular, and one can only lose up to 20 to 25% of the fat. And if someone has really dense fat or stubborn fat, they may need more than one applicator. And how your body responds to this procedure really depends. Everyone's body responds differently. So as you see that, so we are starting the second treatment, and she is put this specific gel pad. So that is going to protect her skin from any cold burn. So she will be placing the applicator as you watch. So the applicator, the suction, so she starts the negative pressure, and if you watch while she's applying, she's checking to make sure that the gel pad is outside the applicator, and she's trying to lift the applicator to see whether she can't. Yeah, so it is nicely stuck exactly where we want. We are going to secure that in such a way so that it does not come off during the procedure. And she is comfortable. She's actually watching her favorite show. And this is our CoolSculpting procedure room. We will do our best to make sure that you're comfortable while you are getting the treatment. Without undergoing anesthesia, without undergoing like surgery, it is possible to really see she's trying to pull it. So we are not using two machines at the same time today because her belly is so tiny. So there is no place for us to put two applicators at the same time. But if needed, we can also use the second machine, like as you see here. So she is going to be starting the treatment right now. So as you see here, once the treatment starts, there she starts the treatment. So 35 minutes. And initially when you start the treatment, it feels very cold. And how does it feel?
Like cold and a little tingly.
Tingly.
Yeah.
And it gets numb afterwards?
Yeah, after
a little bit. How were you with the first one? Were you comfortable?
Initially it was like, ooh, this is cold, but then it was totally fine.
How did you feel after it came off?
Yeah, it was definitely cold. Definitely changing temperature was a little shocking, but it was totally fine after.
How did you like the Z-Wave?
Oh, that felt good.
That was good?
It takes the sting out, honestly. It takes away the spiciness.
So once again, this is Dr. Shanthala, and this is our CoolSculpting procedure room. This is how you will be treated when you are here. And sometimes we turn the lights off so that you are comfortably watching the TV while you're having the procedure. This looks like a dream place to get the CoolSculpting. So ta-da! So thank you guys. Thank you so much. It's a beautiful day out. So hopefully we will be doing a lot of walking and hiking this weekend. The sad part is no matter how much we exercise, how well we eat, sometimes it's very, very hard to treat certain areas. That's called stubborn fat, and that is the area which can be treated with CoolSculpting. So if you have any questions, please give us a call. Contact Arlene. She's my CoolSculpting queen. I don't even come to this room. She takes care of everything now, and will take excellent care of you. So we both got vaccinated in February, but we still wear masks. And most of our patients who come here, they've also been vaccinated. So fortunately, things are under control, and I hope it stays the same. So next week is Mother's Day. We do have some special promotions to celebrate all the women, all the moms out there. And we will be sending an email today. So have a great weekend, and thank you so much for your support and helping us. Give us a call and let us know. Take care.